I'm Ellie.
Hi, I'm Ashlyn.
I'm Alicia.
And I'm Erica.
And we're Davenport University nursing students. Today we're going to be teaching you how to take vital signs.
I'm going to be talking about pulse ox and respirations.
And I'm going to be doing the 1 and 2 step blood pressure methods.
I'll be teaching you how to take temperature.
And I'll be doing the pulse.
Okay, I'm going to be showing you how to do the 1 and 2 step blood pressure method. So for the 2-step method, you want to do the 2-step method if you're unfamiliar with the patient's baseline systolic pressure. So you want to palpate in the area, make sure your arm is up and at the heart level. Palpate the area and feel for the brachial pulse. Okay, so it's right there, and then you want to take the blood pressure cuff, put it approximately 1 inch above where you felt the brachial pulse. Okay, put your fingers back on the brachial pulse, and then you're going to pump it up slowly, and you're going to continue pumping it up until you no longer feel the brachial pulse. Okay, so I stopped feeling it at about 120, so I'm going to let it deflate. I'm going to give her arm a rest for about 30 seconds, and then I'm going to take my stethoscope, put it on. So since I stopped feeling it at about 120 millimeters of mercury, I'm going to, when I take the blood pressure, the 1-step blood pressure, I'm going to inflate the cuff to be about 150 millimeters of mercury. Okay, so I have the diaphragm against the brachial pulse. I'm going to tighten or inflate the cuff to about 150 millimeters of mercury. And I'm going to slowly, about 2 to 3 millimeters of mercury per second, I'm going to release it. And the first sound that I hear is the systolic. And the last sound that I hear is the diastolic. Her blood pressure was about 118 over 76, and that is a good blood pressure.
I'm now going to be showing you how to take temperature. The hypothalamus in the brain is what regulates body temperature. Normal body temperature is 97.3 degrees Fahrenheit. Body temperature is affected by age, exercise, and environmental conditions. Body temperature can be taken through different routes. These routes are oral, axillary, rectal, temporal, and ear. The rectal route is the most accurate because it gets the closest to the core body temperature. So when you get your thermometer, you take it on, or you turn it on, pull the probe out, put a probe cover on, and you can select the route by pressing this button. You can go to axillary, you can go to pediatric, axillary, back to oral. So I'm going to put this in the patient's mouth underneath their tongue and have them hold it until the screen beeps and displays the temperature. Her temperature was 98.6, which is a normal temperature. The first thermometer created was glass, which is still used today, but not as frequently as electronic thermometers because of convenience. What is a fever? A fever is a temperature above 100.4 degrees Fahrenheit. There are 3 important things to do when a fever occurs. First, determine the cause. Second, monitor the temperature and other vital signs. Thirdly, it is important to observe clinical signs that accompany a fever, such as seizures. According to the Mayo Clinic, it is important to seek medical attention for a fever that is 103 degrees Fahrenheit or higher.
All right, now I'm going to teach you how to count respirations and how to use a pulse ox reader. First, to count respirations, always do it when the patient is not aware, so they don't change how they're breathing. And many times, nurses will take the pulse for 30 seconds and then do respirations without the patient knowing. And then when you get the number for the respirations, you would multiply that by 2, and that would be your respirations. Normal breaths per minute are between 12 and 20. Now I'm going to teach you how to take a pulse ox. It can be taken on either the finger or the earlobe. It measures the amount of oxygen that is being carried by arterial blood. It calculates pulse saturation by light that passes through the site where this little piece goes. Normal pulse saturation is 92 to 100%. So I'm going to turn this on, and I'm going to put it on the patient's finger and just wait for the reading. So as you can see, her pulse ox was 97, which is within normal range. One thing to note is that if the patient's fingers are really cold, it can lower the reading, and you would just want to warm the fingers up.
All right, now I'm going to teach you how to take a pulse. So there are many different locations on the body where you can find the pulse. These include the peripheral pulses, which are the radial, brachial, carotid, dorsalis pedis, femoral, posterior tibial, popliteal, and temporal pulse, along with the apical pulse. So the radial pulse is the most frequently used. And to measure the radial pulse, you have your patient sit upright or lie flat, and you're going to palpate the radial artery by placing the tips of your index and middle finger in the groove on the thumb side of the patient's wrist. And you're going to press lightly until you feel the pulse. And you're going to note the rhythm and the quality, which would be described as bounding, strong, weak, or thready. And then you're going to count the pulse for 30 seconds and multiply it by 2 to get the beats per minute. For all other peripheral pulses, you follow the same procedure as finding the radial pulse. And to assess the apical pulse, you have the patient lie down flat or sit upright, and then you're going to wipe your stethoscope with an alcohol wipe. And you're going to palpate the fifth intercostal space by sliding your finger down the sternal notch to the angle of Louis, and then moving over to the left to find the second intercostal space, and then you're going to count down to the fifth intercostal space. So 2, 3, 4, and 5. And then you're going to slide over to the midclavicular line and feel for the apical pulse. Then you're going to find the pulse with your stethoscope and count for a full minute. In most facilities, vital signs are measured upon admission or taken per facility policy.
In the hospital, these can be taken every 4 to 8 hours. In a long-term care facility, these can be taken weekly, bi-weekly, or even monthly.
Pain is considered the fifth vital sign in some facilities. Pain is important to assess along with vital signs because it provides a better overall picture of the patient's status.
In most facilities, vital signs can be measured electronically. However, it is important to know how to do them manually in case of machine malfunction or a false reading.
Thanks for watching, guys. Hope you enjoyed.